we do know that family planning is one of the best ways to improve or reduce maternal mortality and morbidity. When you do family planning and spacing, the woman is able to recover for the next pregnancy. Not only that, the little child born is also strong enough to be taken care of before you get another one. So I think this is good. And the best way to reduce maternal mortality and morbidity is family planning. So that's why we took it with utmost importance to say, yes, family planning in Gombe State, because if you see the indicators, the indices is showing high maternal mortality. And one of the ways, well, number one is hemorrhage. Number two is other morbidities and mortalities from infections, infestations from pregnant women. Now, if a woman is able to do family planning, she recovers before she takes the next pregnancy, and that gives her an opportunity to survive more. And the same thing with the infant mortality. If a newborn child is with you, and he did not recover, he's not strong enough, you've thrown it away because you have another one. So the care that he's supposed to receive is no longer there, and at the end of the day, both two babies will be missing. Let me first start by saying that generally every person trying to access health, the primary healthcare unit is the first point of call. And it is important that if you want to do any family planning program, you start from there. And the impact there has been quite significant and quite impactful, meaning we want to reduce maternal mortality and morbidity and infant mortality and morbidity. And one of the best ways is to embark on family planning too. So the impact has been quite significant, like I said, and the uptake at that level, following massive sensitization, there's increase in uptake of family planning commodities and procedures, and that has also reduced maternal mortality, infant and child mortality. So the impact was significant in Gombe State with the introduction of the TCI Challenge Initiative, where commodities, partnership, and this were brought in, and particularly leadership. There's good leadership from the TCI initiative, and the collaboration was superb, and commodities brought in, trainings provided, gave the impetus for the impact we see at the primary healthcare level. There are so many things that came in, like I was mentioning, but what was the major gateway that opened up acceptance, and this was the 72-hour makeover facility that was produced in each of the clinics that were providing family planning services. Hitherto, the place was just one room and general, with any other person coming in for routine complaints. But when the 72-hour makeover shift was made, it provided a lot of privacy. You know, when you are providing these services, the environment matters, the culture counts. And here, people initially, when they even said family planning, they were repulsive of it. But when we modified it and said, no, child's person, they now say, okay, we know that, we could do it. So, and you provided that 72-hour clinic, it gets privacy, provided conveniences, provided the environment to be secured and fulfilling for a person to come in with his wife or alone to access family planning commodities. I think that's one key area. Then another one was the leadership in the TCI. When they come for the advocacy, they didn't just come to say, please come and do this. They came with some data, some key findings in Gombe that says, look, this is your indices in this area, but if you embark on this program, you're going to have a change. And that has contributed immensely. Another major thing that has made it, you can put in all those facilities, but when the human resource is not there, a trained human resource. Now the training that were conducted, master trainers were provided, and they cascaded down. So that made the difference, and the change was enormous. Well, we were given services, and like I said, whatever you are doing, if there's capacity building, the performance becomes better. Prior to coming up TCI, this training was suboptimal because of this thing. So we got improved training for our human resource, then capacity building. Then we got some infrastructure in the facility. Those make the 72 make our shit. When we got some commodities, and then monitoring and supervision. Whatever you're doing, if there's no monitoring and supervision, is as good as not doing it at all. So that partnership enhanced the monitoring and supervision we were doing, and it also gave us an enabling environment to make sure things are moving well. Yes, the motivating factor was the leadership, both sides. Our governor, His Excellency Muhammadu Inuahia, embraced the program, accepted it, and accepted TCI Challenge Initiative as a program in Gombe State, and agreed to partner. And the partnership yielded this result. And the leadership at I keep saying the leadership at TCI, the state coordinator and the national and international contacts were relating very well. We developed plans, we monitor the plans, implement them to the letter, and then we evaluate after that. These are key. Whatever you bring in, if there are no plans, they will not work. So we first develop the plans, then we implement them, then we supervise and monitor. These were the key things that made the great change. Well, there are a few things I must say. The learning points were training. When they came, people were there, they are working. Most of them from college, from the university, they started working. They didn't get additional training. Now, TCI brought in training, these master trainers. The master trainers now cascaded down to the other sub-facilities to give that skill and knowledge on the application. Then the issue of providing a special budgetary line. The advisors, look, for you to sustain the program, you need to have a budget line for this. When you go, they started guiding us as to when they go, how do we sustain the program? These are all learning this thing from them. So we have now put in place a structure that even if TCI moves out, we are ready to go. We will sustain the program. Yes, you see, with the TCI, they are part of we have the partner coordination. We've been regularly having partner coordination meetings, and TCI supported us to even bring all partners that are providing family health, family planning. So we are able to see how we could put resources together like a basket. Say, okay, TCI is coming, this one is coming, this one, all for family planning. Now, how do we make the clinics standardize them? How do we make the personnel train? How do we make sure commodities are flowing uninterrupted? How do we monitor abuse of commodities and so on and so forth? So these were all areas that I think were quite helpful in from TCI, the coordination of all other partners that are working with us in family planning. We put heads together to ensure it's one health, one goal. Well, number one is the political will to say we will do it. Number two is we have a budgetary provision. We have a budget line. Number three is to ensure we are giving our counterparts funding regularly to all those that are coming, to ensure that with our counterpart and whatever is brought in, we'll be able to do that. Number four, that training, what you have impacted, if a person knows the value, he will do it and it will be sustained. But where a person is ignorant, doesn't have the value of what he's doing, he may not do it well. So the value of that capacity building and training will sustain the program. Yes, I told you first, there's a political will in Gombe State. Health is our number one priority. His Excellency the Governor prioritized health. And in health, we are much concerned about maternal mortality and morbidity. And we believe family planning is one of the ways to reduce maternal mortality and morbidity. And now, that is why the budget for this program, we procured over 37 million naira worth of this. And we consistently, every year we have a budget for family planning commodities. Hitherto, it wasn't there. But because of the political will now, under the leadership of His Excellency the Governor, Muhammadu Inuaya, then mainstreaming into the other sectors, each sector now complements. And with that, we're able to reach where we are. But the key thing I want to say, there's the political will, there's a budgetary provision for that, and we're able to, it's one thing to put something in a budget, and it's another to get it released. And we put it in a budget, and we got the release, and we procured. Our procurement processes, we follow the due process to ensure commodities that are meant for are procured in tune with the quantities required. Sensitization. We did massive sensitization. When you come into place, you want to introduce a program. The TCI were able to work with the gatekeepers. You come in here, the traditional leaders, religious leaders, key stakeholders in health, the entry point, the ministry, budget planning and partner coordination, then the community at large. We work together as one team, and there was massive sensitization. With the sensitization, there is now increased uptake, and with increased uptake, you see the results of reduction in the morbidity, mortality, and reduction in also unnecessary or unwanted pregnancies. I told you how it came about. The will, the political will is there because we said health is our priority, and family planning is one of the components that is in the health budget. And then advocacies. The TCI was advocating both from the State Assembly, from this ministry, and all stakeholders. And the partner coordination that we coordinated and produced a project that will impact, and it has impacted. The presence of TCI at any time we need them. They were just there every moment with them throughout. There were no break, consistency and proactiveness, then always willing to provide what we wanted, like the training, like the supervision, like the monitoring, like the training and retraining. These were key. You see, the ministry is the fulcrum. The ministry, I have about 6-7 agencies, and I have to coordinate them, and we have to work together to see the success. Now at the ministry, I have the health management board, where I have the personnel that are working. Then I have the Gombe Contributory Health Scheme, that's the health insurance, where people will have access to care. Then I have the Primary Healthcare Development Agency. I have GOMSACA, for HIV and AIDS. And all this have to be coordinated together, because everyone will need to go to the hospital, to the facility, and there are ways we have to link family planning to each of the programs for us to make sure the program is successful. So the coordination, I have to make sure the staff are working, and that's why I need the health management board, where they have the personnel. The primary health care, they're the implementing side as well. And I will have to give the oversight function at all levels. And whatever I am doing, all the agencies, we're working together as one team, because we're providing one health in Gombe State. The State House of Assembly, key. The House Committee on Health, because when we went and said we need this money, or we need a budget line, we need to increase our health budget to 15% of the total budget. We need to also, within the budget, make sure that this amount is given to family planning. We also need to make sure that the amount given is released. So we had to spread out, to reach out, high-level advocacy to the House of Assembly, to other key stakeholders in health, our partners and the rest, and that's why we're getting what we have today. Well, let me tell you, the Deputy Governor leads the primary health care programs in Gombe State and immunization, and we leverage on that, and the press, media, 24-hour coverage and access to us. We share information, and if there's anything, and sharing of that information, dissemination of key messages using the media, extension of the program in Gombe. I would be glad to have that, and I would always be there to ensure I support the engagement when they are here. But I must say, the experience with TCI was superb.